Moderator for today's webinar. The webinar is Understanding PTSD and Developing Coping Mechanisms. Before I introduce our speaker for today, I would like to thank our sponsors for today's webinar. That is VSIF of Canada and Homewood Health. We thank them for their support. Their support makes this webinar possible. Just a few housekeeping details before we begin. You will be able to record questions during the webinar. But we will be saving the questions for the end. The webinar itself will last about 45 minutes, followed by a 15-minute Q&A. So with that, I would like to introduce our speaker for today. The speaker is Debbie Bodkin. She is the principal of Inspiration Presentations. Debbie served as a police officer for 24 years investigating serious crimes, including sexual assaults, drug offenses, and homicides. She also participated in 3 overseas missions in Kosovo, Chad, and Sudan. Like many in the first responder security field, Debbie felt that she had mastered the art of being an effective, strong, and somewhat invincible person. But some of the horrors, stresses, and traumas affected her profoundly, and she was dealt with a mental breakdown issue. She suffered from depression and post-traumatic stress and learned that anyone can be affected. After counseling and coping strategies, Debbie was able to get back on her feet. She retired from policing and became a private investigator, a passionate public speaker, an instructor of the mental health first aid course, and a suicide prevention course. With that, I would like to turn it over to our speaker for today, Debbie.
Thank you very much, Neil. Good afternoon, everyone, and thank you for joining us. I've started out here just kind of giving you an agenda, just a short list of what I'm going to talk about, just so you know where we're going with the webinar. I'll start out with a brief introduction about myself, a little bit about my background, some definitions, just so you all have a better understanding of exactly what I'm talking about. Then I'm going to tell you a little bit about my experience, because I'm not an expert on mental illness as a result of an educational degree, but more so because of what I personally experienced and learned as a result of that. Then I'll talk a little bit about what it's important for all of us to realize and understand in relation to mental illnesses, what we can do to eradicate the stigma surrounding mental health, and finally leave some time to hopefully answer any questions you may have. So first, just a little bit of background about myself. As far as my family, I consider myself extremely lucky because I come from a very healthy, happy family. Throughout my childhood, I've never experienced any tragedies or traumas while growing up. Grew up on a farm, so I always considered myself very physically, mentally, strong all around. It wasn't until I went through my mental breakdown that I sort of looked into my family background a little bit and did find out that my grandfather had suffered from depression. I thought he was just a grumpy old man, but he had actually suffered from depression, and my uncle as well. Throughout my high school years, I decided that I wanted to be a police officer. That was my career dream, and after moving away and going to college and other jobs I took prior to getting hired, everything was geared at my future dream career. Now, just a few of the definitions. Like I said, it's just basically not too elaborate, but so you'll understand the terms that a lot of us use all the time and maybe really don't understand the distinguishing differences between some of the terms. So one of the most common terms that's used now when you're talking about mental health issues, especially in certain workplaces, quite often first responders, definitely the military, that the term actually came from the military, which is operational stress injury, meaning that you have a mental health injury that came as a result of something you've done through your work. And it was kind of developed sort of to get rid of the medical title, be it depression, be it post-traumatic stress disorder, anxiety disorder, whatever the doctor might term it. This sort of is a catch-all phrase to encompass all of those mental health injuries and to sort of take away the stigma that seems to come with those other medical titles. So that's operational stress injury. Some people actually use occupational stress injury, but basically the same meaning. It's coming, the injury resulted from something to do with your workplace. The other term, stress versus trauma, I think that they've been used very much interchangeably when in fact they are extremely different. The term stress and comment, they're so commonly used that most people don't realize there is a difference, and I certainly didn't myself. One of the definitions of stress is a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. Stress is an everyday part of all of our lives. It can come from a variety of things. It just happens. As the slide says, stress happens. But when it happens, hormones are released that are meant to help us. So even if the stress is acute, usually we are still able to survive and to function. One type of stress that I learned about is called eustress, and it's the type of stress that an Olympic athlete may go through just before they're ready to start their race. When the gun goes for them to start the race, the eustress kicks in, which puts them into that fight mode so that their body can do the best race they can. So some stresses are literally good for us. They're required for us to get through certain things. Then there's trauma, which is very much different than stress. And trauma, unfortunately, is what happens to you and which can truly damage you mentally and, at the extreme, can kill you as a result of it. A definition of trauma: it's a deeply distressing or disturbing experience. It refers to extreme stress that overwhelms a person's ability to cope. So that's kind of the big difference between stress and trauma. Trauma is extreme stress that you're unable to cope with. Stress reactions are clearly physiological as well, but we're able to manage them, and we can learn mechanisms for coping, which whatever stress we realize we come in contact with, or what results in us. However, it's an individual's subjective experience that determines whether an event is or isn't traumatic. So what's traumatic for me may not be for someone else. All of our bodies are not designed to withstand chronic emotional or psychological stress, which is what results in the brain releasing these hormonal steroids over and over. So we're not made to withstand that constantly. Because when you do have constant stress, it turns into trauma, and it makes it more difficult for your body to return to that level of balance. It's called neurochemical balance. And the danger response just keeps, the flight or fight response continues to pulse long after the danger cues have ended. So that's kind of the difference. That's what trauma is. So just for an example of what would happen if you've suffered a trauma, or can happen, say if you were in a severe car accident and just before the accident happened, there was a certain sound. The next time you hear that sound, your brain will trigger a defensive response, just like it did when the car accident actually happened. So you're actually reliving that trauma. Another terms that are quite often used interchangeably, or maybe the definition of them really people don't recognize it, is critical incident stress versus cumulative stress. A critical incident is a severe event that everybody recognizes as something which could possibly overwhelm a person's ability to cope and disrupt their normal functions. Because everybody recognizes it, it has an advantage, because it's sort of a, for lack of a better term, it's a headliner. Everybody's aware of it, it's a mass casualty or whatever, and people realize that anyone involved in it may need some help, some peer support, some psychological support or whatever. It's recognized that as that big of an event that it could be difficult for people to deal with. And as a result of that, people usually get the appropriate help, peer support, psychologists, whatever it may be. And as a result of that help, the odds of them recovering from being involved in a critical incident is much greater than if they had not received that help. Cumulative stress, on the other hand, it's not a headliner. It's not one big incident that everybody recognizes. It's something that happens because you're dealing with incidents and stressors over and over and over. It can be, various lengths of periods of time. So people don't recognize that something may be going wrong with the person because they've been doing something stressful for 5 years people just sort of forget and think, well, that's their job. They know how to look after it. It'll never bother them. They know how to get through it. But cumulative stress does happen. This list here is called the Terrible 10. And every profession may have a list of their own sort of worst case scenarios that could be categorized as critical incidents. A lot of first responder, emergency service organizations would use this list, this Terrible 10. And as I mentioned, they are headliners. You know, we would know that someone who's been involved with the in the line of duty death of a colleague, or the suicide of a colleague, or serious work-related injuries, we would know that the person who was involved in any of these incidents may need some psychological counseling, or, you know, they're going to need some help to deal with what they've just experienced. As you'll notice, number 10 is literally any overwhelming, distressing event. So that's kind of, again, a catch-all, which lays out that we're all different. Everybody can find a different, or everybody may experience a different reaction to an incident. So again, what might be stressful and traumatic to me may not be to somebody else. But again, this is just a list that's been created of those sort of headliners that do occur. A little more about trauma, which is the dangerous part of stress. It can occur from one incident, or as I mentioned, after cumulative stressful incidents. And again, it can be a minor incident that triggers the trauma. So say I was a traffic cop for 10 years, and I have gone from one fatal incident to another, horrific, stressful, you know, heartbreaking, emotional crashes from one to another. It may be none of those crashes that causes me to have a mental breakdown. It may be that I go home one night and my child, I don't know, cuts his finger with something. And just the sight of his blood might be, it's a minor incident, he just cut his finger, but for whatever reason, that may be what triggers the trauma response in me. And it's trauma that causes post-traumatic stress disorder, which is not simply an injury to somebody's feelings. It truly is a physical as well as emotional injury, and where damage is actually done to the brain. And trauma is what leads to PTSD, post-traumatic stress disorder, and if not treated, it can lead to suicide and other health injuries. And again, there's been many, many studies done in regards to mental health and mental health injuries, occupational stress injuries, and it's been proven that the awareness of the signs and symptoms, which I'm going to talk about further, of trauma, do help to reduce the likelihood of a traumatic stress disorder developing. So it's just kind of the old education is power, knowledge is power. So the more you know about it, the more you understand it, and the more you will hopefully respond in the appropriate way, look after yourself. The definition of trauma can include responses to powerful one-time incidents like some of the ones that were on that critical incident list, accidents, natural disasters, crimes, deaths, any violent event. But it can also include responses to chronic or repetitive experiences, like the cumulative experiences, and some other examples are child abuse, neglect, being in combat, seeing or hearing about violence on an ongoing basis, enduring deprivation of whatever kind. But again, one person cannot determine whether a particular event is traumatic or not to another person. That's up to each survivor of a trauma. It's up to their body. You know, sort of what happens to them might not happen to the person standing right beside them experiencing the exact same incident. And again, I really find this very important to point out that, as the slide says, for those that tell me, you know, PTSD, it's all in your head, yes, it is. It truly is. It is a physical trauma to the brain. It's physical damage, not just the thoughts the person's having. Without getting too technical, which I'm not a technical person and I'd get confused, I just want to sort of briefly explain a little bit about what happens in our brains when we are presented with a stressful incident, critical incident that results in trauma. So when we're in a dangerous situation, we have little or no control over what's happening in our brains. Many areas are activated simultaneously and instantly when we're going through this dangerous or stressful situation. That includes the areas that control our emotions, our behavior, our motivation, and our long-term memory. So the more emotionally arousing an experience or event is, the more parts of our brains basically kick in and are activated. And as a result of that, the more firmly the memory of that experience is ingrained in our brains. So when somebody suffers a post-traumatic stress flashback, they're events that didn't become memories in the way we think of normal memories. They're literally events coming alive again. The stress hormones are released again, and they're released every time a flashback occurs. So say the trigger might be a car backfiring, or someone yelling, or the example I made there when your child cuts his finger and you see blood. That might be your trigger, and when that trigger kicks in, your brain and the ingrained memory kicks in, which causes those parts of your brain to activate again. And all those stress hormones start being released, even though you're actually not going through that same trauma again. So the long-term activation of this stress response system within us and the overexposure to stress hormones, as I already mentioned, can disrupt almost all of our body's processes, which puts us at risk for many health problems besides just mental health problems. You know, our brains are an integral part of our entire body, all interconnected. So we really have to pay attention to what we're thinking, our emotions, our feelings. Overall, we really have to pay attention to it. So a little bit more on cumulative or mixed trauma. Again, it can take place over years, and it truly can lead to a lifetime of nightmares. Some other causes besides one of those critical incident headliners is just working on a job that has constant risk. So every day you go into your job, you know, it's a job you've chosen, be it policing, security, fire, whatever it might be. You've chosen that job, and you went into it knowing that it will be stressful, and you have to be strong and all that stuff. But just your body having to know that as soon as you put on your uniform or step inside your work door, that you're at constant risk. Your internal hormones, your body is working internally to put you in that mode to be able to do that. So that can eventually cause trauma. Also, if you're in a job where there's that need for adherence to quite often, very restrictive and conflicting regulations and those frustrating things that all of us have been through in workplaces, rules and policies and so on, that can cause as much stress as the job itself. And continuous, having to work under that can also result in trauma. Then there's the public perception about what we should be like, whichever job you're in. The public perceives what we can and can't do, which might be totally unrealistic and totally inaccurate, and that weighs on us as well. And then back to the critical incidents, the big headliners, violent crime, shootings, and mass disasters, of course, can result in mixed trauma and cumulative trauma. So as I mentioned in the beginning in my little agenda, I'm not an expert in regards to having a educational degree in post-traumatic stress disorder or occupational stress injuries. My knowledge came from my own personal experience, and as a result, the best way I know how to share what I've learned is by giving you a brief overview of my story and what happened to me. So start out just very briefly giving you a snapshot of what my dream career turned out to be. I joined Waterloo Regional Police in 1987 and had an awesome career. I worked in uniform patrol. I worked in criminal investigations, mainly specializing in sexual assault investigations. I worked in drug investigations, got trained in some undercover work. I worked in the homicide branch, naturally investigating murders and suspicious deaths. Went back to patrol as a supervisor after I was promoted, went back to uniform patrol for a little while, then went back to plainclothes and worked in what we call our intelligence branch, excuse me, where I did gang investigations, some drug investigations, did a lot of confidential paperwork that had to be done, and so on. And then finally, I finished off my career going back into where I chose to be, back into sexual assault investigations. So I had an amazing career with a nice broad spectrum of the different things I got to do. When I started my career, I knew nothing about mental health whatsoever, and it wasn't until my own breakdown that I started to become knowledgeable and have continued on that path. I knew a little bit as a result of when I was on the police service. I was a crisis negotiator, so you kind of learn to understand emotions and, you know, stuff like that a little bit. I also took some of the critical incident stress team training, you know, the peer team that was called out to assist other people when there were one of those critical incident headliners. But since then, I've also attended multiple conferences. One of my favorite organizations is the Tema Conter Memorial Trust organization, which is geared specifically for first responders, but they have wonderful educational days about mental health. I've also become very involved in the Canadian Mental Health Association. I was the board president for the volunteer board in my area, and I've done a lot of online learning and have become good friends with peers who have gone through their own mental health breakdowns, and you learn so much from one another. So that's kind of my, my background as far as my career and my mental health knowledge. I throw this slide in, which was my first marriage, which fell apart. But I throw it in just for a little more understanding of what I think things are changing, but what I should have known way back in the start of my career. Of course, before I started on the job, I knew there'd be work stress when I become a police officer. I knew marriages often didn't last very long, but I didn't know anything about the trauma-related stressors that I've talked to you about. So I did my first few years in uniform, criminal investigations, then the plainclothes drug work. And it was around the 10-year mark on the job that my first marriage was pretty much in shambles. However, before we called it quits, we did take the step of seeing a counselor to see if it was salvageable. And we utilized our EAP program, which a lot of workplaces have, Employee Assistance Program, where you can go see a counselor or social worker free of charge through the organization. So my ex-husband and I did that. And of course, when we went to the, this young counselor, I blamed everything on my husband. He was likely 75% at fault, but I could be wrong. But in reality, looking back now, the reality of the situation was I had changed a great deal because of work-related experiences. After 10 years of being in a first responder job, all of us would naturally change because of what we've seen and what we've experienced. I'd learned on the job how to shove everything away as far as emotional scars from work, and that resulted in the eruptions of a lot of nasty emotions directed at my then husband. So that certainly wasn't covered during the counseling sessions at all. And looking back, it certainly should have been part of the focus. What has the job done to make me a different person than I was when I initially got married? And I think now, if I had known and understood what I do now, I would have been better equipped to recognize what was going on with me and my marriage, and hopefully could have maybe dealt with it better. Now going back into sort of my career when I was in homicide, it was in 2000. I was working in the homicide branch that I was assigned one of the worst cases that I ever had to deal with, which was the murder of a woman and 4 children by the woman's husband, the children's father, who then died by suicide after. But the crime scene was absolutely horrible and bloody, a terrible scene. And the fact that there were children, of course. A fellow officer who had young kids and who was senior to me, I always have great respect for him. We knew what the scene was going to be like because other family members had found it before we went inside, and this fellow officer said, you know what, I don't think I want to go inside, because he realized the scene would be scarred on his memory, and he had 2 young children at home the same age as 2 of the children that had died. So I continued on with my job, and myself and the rest of the team conducted the investigation, looked after the distraught family members, etc., and did what we were trained to do. That case was dealt with. A few months later, my next case came along, which was the murder of a man. It was, again, a horrible crime scene. But again, that was part of my job. I'd been trained in homicide investigations, and I did my job. When the case was completed of that second case, that second crime, the murder of the man, when I'd completed the investigation, I was working on the paperwork that we have to prepare for court in regards to the party that was charged for the murder. While I was doing that, I was alone in a room at the police station doing this paperwork when suddenly I was envisioning what I call the dancing baby, which you can see on the slide here, which is, you can Google it on your computer, and this dancing baby, you'll be able to find it, would come up. It's a computer-generated baby that used to play on a television show that I used to watch. The show was Ally McBeal, and this dancing baby would run across the floor in this law office on this television show. So as I'm sitting in this room doing my, it's called the Crown Brief, the paperwork for court, I envisioned this dancing baby, but it had a bullet hole in his head, but it was dancing around the room. And there had been a baby at the family homicide, the crime scene, and the baby had been in its diapers and had a bullet wound to its head. So the vision, of course, freaked me out. I was thankfully alone, and, I think like anyone would react, thought, what the heck was that? What just happened? But I basically, talked to myself and thought, I'm overtired, overworked. I realized where it came from, that it was from that homicide scene, but I literally forced it out of my head and just shook it off and continued on with my job. So as I look back now, I'm sure that was my first occupational stress injury. That certainly was my first flashback that I'm aware of. And I'm sure after that baby vision, I likely went home and enjoyed a glass or two of wine, which it really became a sort of go-to after a hard day's work. I never, I don't think, abused, or it wasn't a regular everyday had to have my glasses of wine, but it was definitely a crutch. When I had a bad day and had, dealt with a lot of victims or a terrible case, I'd go home and have a glass of wine, like many of my coworkers did. And there were also bad days where we overindulged. And unfortunately, in our culture, alcohol is an acceptable outlet or crutch to deal with stress, when in fact it really doesn't help with it. It'll dim it for a little while, but in the long run, especially if you're suffering trauma, it in fact accelerates and greatens the reactions your body suffers as a result of a trauma. So it really doesn't help. It hinders your getting past the trauma. As Neil mentioned in my biography, I did do some overseas trips. The first one to Kosovo was through the police service. They sent me for a month to interview, to conduct interviews and investigations in regards to the war crimes that had gone on in that country. So basic police work just in a war-torn country. Prior to going, I had to go and see a psychologist, which, looking back now, I think that's great. They really did take in consideration your mental health. So we had an hour-and-a-half interview with a psychologist before we left for this one-month mission. And again, when I returned home, I had to go for the same interview again to make sure that, we were dealing with, I worked in a morgue most of the time while I was in Kosovo, to make sure there weren't any lasting effects on me. So it really was sort of my first introduction to a workplace thinking far enough ahead to think there could be mental health issues coming back from a war-torn country. And I kind of chalk that up to the military have been the leaders, the veterans have been the leaders in changing how we look at mental health. And then there were my other overseas trips, which the Kosovo was the original one, and it just sparked my traveling bug, and I applied for 2 more overseas jobs utilizing my police experience, both in Africa, where I interviewed people who were victims of horrific crimes against humanity. While there, I never witnessed any crimes. I'd witnessed plenty at home back on the job, but while I was there, I never witnessed the crimes, but I did experience the psychological and physical scars on all the people that I interviewed. And when I came back, I considered the experiences wonderful and terrible altogether. Terrible to know what people were going through, but wonderful in that, you know, I was able to help in any way I could by being there and interviewing them. So when I came back from my trips, I went back to my work. I was in the intelligence branch then, working on the gang investigations and so on. As I mentioned, my job consisted of a lot of internal confidential paperwork as well. So I came back to my job, and I think for the first little while, all was good, par for the course. I've always been a very social, outgoing, fun-loving person, so I usually loved working in the midst of a busy police office. In the intelligence branch, we were jammed in an office with, on average, say 8 officers working in the small area at the same time, but we had fun while we were doing it, and I loved being part of that. And I was also the first one to say yes on an invite of, you know, going out for drinks or going for dinner or whatever after work, any kind of social get-together. I was usually always there. But during my job, doing that confidential paperwork, I also had a small room to do that paperwork that I was responsible for, and only I and my boss had a key for it. And initially, when I got that job, I was in that room as little as possible because I preferred being out with the group. When I came back from my trip and back into my job, you know, maybe a month or 2 after I was back, I never really realized it, but more and more, I started changing. I started to segregate myself by being in that secure room more often than being in that main office with the rest of the guys. I seemed to want to be alone. I also started to go for my coffee breaks alone. I would go to Starbucks. Most of the guys went to Tim Hortons. So I was purposely going to Starbucks, which is attached to Chapters, and I would literally get my coffee and go and sit in an aisle in Chapters where I knew I wouldn't run into anyone that I knew. So I was really purposely segregating myself. And I also, bit by bit, started to become much more emotional at work. I was becoming depressed, and so depressed that I'd find myself getting ready to go into tears at work, and I would literally have to run into the washrooms and hide and have, you know, a crying spell, fix my makeup up, and go back in front of the guys. There was no way I was going to let on to anyone what was going on because I maybe didn't really realize it or recognize it initially, but I didn't understand it, and it's just not something you do, is let somebody see you cry or see you upset while you're on the job. So I really started to hide myself as these emotions started to take over. Then I sort of hit the tough time, my dark time. Suddenly, I was no longer that same happy social person I'd always been. But I didn't let on to anyone at all. Families, friends, coworkers, nobody. And this was, you know, took place over maybe a 2 or 3 month time span that it got this worse. I didn't tell anybody what I was feeling. I would just put on a fake look while I was at work and always scurry home right after work. Along with usually being a very happy person, I'd always been a very healthy person, and I ate properly, went to the gym almost daily. That all changed. I didn't care about exercising anymore. I was too miserable, really didn't have much of an appetite. I just ate crap, and I felt terrible almost all the time. But because of the stigma of mental health issues and my fear of what others would think of me, I never told a soul. I'd made a lot of friends in Africa who I had initially kept in touch with regularly, but now I didn't want to hear from them either. And I stopped having email contact, didn't phone my local friends, didn't email my faraway friends. It just seemed that nothing made me happy at all anymore. And these are the symptoms that I truly started to experience on a huge scale. Exhaustion. Even though I wasn't exercising anymore, I was just tired all the time. Seclusion, as I mentioned. I went from a social person to a hermit. And the scariest part was I thought I was going insane. I was absolutely terrified I was losing my mind and didn't know why or how it was happening, and it was terrifying. I had a sudden lack of concentration, so it made it difficult to do my work, but I kept at it, never called in sick for work. I did my job as best I could and didn't let on. But I was unable to control my thoughts. I could pay attention to what I was doing for a few minutes, but then my thoughts would go somewhere else. And literally, I just had no fun or no interest in having fun anymore. I didn't know how to make myself happy anymore at all. So since I was not spending any time with other people, all I did was think and remember. And suddenly memories of literally everything started coming back to me. Memories I'd long since forgotten and never thought they had bothered me at all. You know, memories of children being left outside while parents were drunk partying, sexual assault victims who would never be the same because of the crimes they'd been through, my first death notification, the first time I pulled my gun, memories of all the people in Africa who were still being attacked and who I couldn't do anything more for. It got to the point where I would be going out to do groceries, and all these thoughts of all these different victims who I dealt with over my years would just start taking over my thoughts, and it made getting groceries difficult because I couldn't concentrate on what I was there for. But I was literally ruled by the stigma of a mental health issue, and my thoughts were, don't tell anybody, don't take time off work, cover it up, suck it up. I chose this job, and I chose the overseas trips, so I should be able to handle it. And literally, I'd been trained to cover up my feelings, both from the stigma and also I'd had undercover training, so I knew how to hide it from everybody and go to work and, you know, maybe not be the happy-go-lucky social person I'd been before, but I went to work, did my job, and then came home. I even went to the point of making a lunch date with a best friend of mine when I was feeling really desperate and confused, but I didn't know what to tell her, what was going on, and it just wasn't like me to be weak, so I was too embarrassed to say anything, and I left feeling mad that she didn't see something was wrong with me. So I was that good at covering up, my best friend didn't even recognize that I was hiding what was going on in me. So finally I knew I had to do something and get some help. I didn't want to go back to our employee assistance program because besides the young social workers they just didn't seem to know, you know, they weren't a first responder, so they didn't get it, kind of, and it was across from the police station. So instead I went through the phone book, found a psychologist, something about her ad clicked with me, and she worked out of her home, which I thought, oh, that's good. It's out of Kitchener-Waterloo area. Nobody's going to know I'm going. It's in a private house, and I basically hit the jackpot with the woman I went to. She very quickly made me feel safe, that I could trust her with all my dark secrets and feelings, and literally very quickly I went from pushing everything down and hiding it to the floodgates opened. I bawled my eyes out with every session as I told her my stories and all my feelings and all the memories and so on. And the most important thing I learned through that is what she told me, which is it's normal. That everything I was experiencing, I wasn't going insane. It was a normal reaction by a normal person to abnormal events, to, in my case, cumulative abnormal events. So that was a huge weight off my shoulders to know it was normal. She also introduced me to post-traumatic stress disorder. I had no idea what it was before. I'd never heard the term, but I was experiencing all these parts of post-traumatic stress, the nightmares, the flashbacks, the emotional numbing, not being happy, no positive emotions, avoiding anything that made me think of the different traumas. I didn't experience the exaggerated startle reflex, but I certainly experienced the insomnia as well. This is one of my favorite slides, and what I learned again, post-traumatic stress is as normal a reaction. It's a normal reaction to extreme trauma, just as bleeding is a normal reaction to being stabbed. It truly is a physical trauma. So after a number of counseling sessions and continuing on at work without anyone knowing I was going through a difficult time, I slowly started to realize I couldn't keep putting on the fake smile and pretending all the time that everything was great. I knew it was okay and human to feel mentally crappy. And I really had to, it took me a long time to get past the guilt feeling I had for me being messed up and needing help when all the victims I dealt with through work are the real victims who deserve help, not me who's supposed to be the helper. And that's the toughest part for someone with the rescue personality, is to admit that they need help. So some of the coping mechanisms that the counselor taught me were journaling was one of them. Not my favorite thing, but on those nights when I couldn't sleep, you start writing down what you're feeling and you just get it off your chest, get it out of you. Writing definitely helps. I'd always loved photography, and the counselor suggested getting back into photography. I've also, for whatever crazy reason, loved the look of cows. They're great subjects for photography. They usually look directly at the camera and don't move very fast, so you can get good pictures of them. I also soon found out they're great listeners. So if I didn't feel comfortable, I wasn't going to see my counselor right away, but I had some stuff to get off my chest, I talked to the cows. As crazy as that might sound, just speaking out loud what I was feeling, what I was experiencing, what memory I just had, literally helped me move past that feeling. And as I said, the cows are extremely attentive. I'd always practiced yoga a little bit before, but I started doing more and trying different styles, and suddenly it started to help me so much, I've been hooked ever since. It's amazing, clinically proven to help with post-traumatic stress and other occupational stress injuries and mental illnesses. And now there are even specialized yoga classes designed specifically for PTSD survivors and other mental illnesses. So if you haven't tried it, I highly recommend it, even if you only take a few classes and learn how important slowing down your breathing is for your entire well-being. A few months after my Africa trip, I was interviewed by the newspapers, and by then I'd had a little bit of counseling, so I opened up a little bit by letting others know I was carrying some pain, but I certainly didn't let on how badly I was mentally struggling. The heart of my dark time took place near the end of about 2005, but my overall behavioral behavior changed, I was going to say for much longer, but literally forever. I'm much happier now, and I am social again and everything, but I'll have forever the traumatic injuries that happened to my brain will be there forever. And I've learned that the more I talk about it, the better I feel. While I was still on the police job, after I found that doing my intelligence job just wasn't rewarding anymore, and I think it was that part of me that felt I'm the helper, I need to be helping other victims, I don't want to be the victim. So I asked to go back into sexual assault investigations, which maybe wasn't the right thing, but for my last 2 years of work, I did go back to sexual assault investigations. And at first it was, more rewarding for me, and I continued with those investigations, but it weighed on me to the extreme that I just couldn't handle the trauma and the grueling weight that came with dealing with all these victims again. I couldn't handle it the same way I could before my breakdown. At one point, I went into the women's locker room one evening just to catch my breath and do some yoga breathing to be able to get through the rest of the shift. And at that time, I recalled that when I first started on the job, a police officer had killed himself in the men's change room right beside me, and I then realized how a person could end up in that position. I wasn't there, but I realized how a person could end up there. And then finally, while I was still on the job, a coworker of mine who I had supervised started failing miserably at his job, showing many, many signs of suffering a mental illness, signs which I wasn't healed enough myself to really recognize. And although I did, speak to him many times and tried to help, I was his supervisor and I was doing my job. And if I knew now what I knew then, I think I would have been a lot better at helping. And he ended up dying by suicide. And to this day, I really wish I had been where I am now, so I had been able to recognize that he was going through many of the things that I myself had gone through. And finally, the end of my career came when I, after one shift, drove myself in front of the emergency, or in front of the hospital, the emergency ward, because I was having chest pains. By this time, I was back in good physical condition, eating right, and I knew deep down the chest pains weren't a heart attack. It was totally stress related to the job. And I was lucky enough, right around that time, my now husband had got transferred and promoted, and I turned 50, so I was able to take early retirement, and I had to leave my career dream job because I just didn't have the emotional stamina to do it anymore. So now I quickly just want to recap some of the things we all need to know. because it has been proven that the more knowledge we have about occupational stress injuries and PTSD, the better chance there is that we will recognize the signs and symptoms and look after ourselves better and seek the proper treatment. I'm sure many of the people on the phone, if you look down this list, I'm not going to read through it all, but the list here, you likely have a lot of these characteristics in your personality. It's called the rescue personality. And I think the number one to recognize is the very last one, which I certainly have, is that someone who's in a first responder position or, you know, almost any job where you're a helper, you hate to ask for help. You don't want to be the one asking for help. You're the helper. So that's a tough characteristic to get past when you are experiencing some of the signs and symptoms we're going to talk about, and you should be asking for help. If you are that rescue personality, even at your own risk, you may ignore and deny the signs and symptoms until it's too late because you're concerned about the confidentiality, like I was, the stigma, fear of being seen weak, fear of losing out on promotion, and you assume that others need help more than you do. So those are the things you really need to recognize in yourself and realize that we all have to look after ourselves, so you've got to move past these. So again, just to recap, some of the common signs and symptoms: feeling disconnected or detached, loss of energy, appetite, sex drive, low enthusiasm or interest in people or activities. You no longer engage in certain activities, being social, recreation, looking after yourself physically, and that limited range of emotions. You just feel numb and you don't feel like yourself anymore. And some of the coping strategies, besides the few I mentioned, the journaling, give yourself permission to share your feelings, like I talk to the cows. Just getting them out is a huge weight off your shoulders. Make as many daily decisions as possible. Don't make any big life changes. I always giggle at that one. I quit my job, but I knew it was the right thing for me. Make opportunities for rest. Realize that all the flashbacks and insomnia that you're going through will decrease with time and become less painful if you're getting the appropriate care and doing these coping strategies. And then just common sense, healthy activities and eating right and so on. And then the stigma eradication. I know that the only way we're going to get rid of the stigma surrounding all types of mental illnesses is to openly talk about it. If you went into work and had to tell your boss you needed accommodation because you have some type of cancer, there would be no shame associated to it or judgment by others that you're faking. It needs to be the same when someone discloses they have PTSD, depression, or occupational stress injury. You should be treated with respect, understanding, and management should be developing the best workplace situation for you without any prejudice or negative comments about what you're experiencing. I now know that I'm not the same person I was before I suffered from my mental health injury or my occupational stress injury or my post-traumatic stress, whichever title you want to give it. The title really doesn't matter. I've learned to pay attention to know that my brain sometimes gets overtaxed because of my to-do list at work or home, because of emotional situations affecting me and my family, or just because it hasn't had a break, basically. So now I pay attention to the signs that indicate I need to look after myself, utilizing what I know works for me. Sometimes I will just say to my husband, I'm going downstairs for an hour of yoga. Don't come anywhere near me. Don't interrupt me. And you just have to do that. You have to give yourself that space. I still don't talk openly to some of my friends and acquaintances about mental health because I sometimes don't have the strength to try and fight through that stigma and try and make them understand. But as often as possible, I speak up and give my acquired understanding of it in order to help stop the stigma surrounding it. The biggest secret, again, to stopping the stigma is openly talking about it. And finally, my view is that we don't hesitate to go to a doctor for things as simple as a sore throat or a runny nose. So why do we not go to a doctor when something is malfunctioning with us, which is one of the most important parts of our body, our brain? Mental health problems are just as serious and just as treatable as physical ailments. You just have to take the steps to see the right person to treat them. So I do an annual mental health checkup. May not always go to the counselor, but just like thinking about, when's the last time I've been to my dentist, I'll think, when was the last time I talked about or really thought about what I'm feeling? So my last words are, we have to take good care of ourselves and realize our mental health is extremely important. And now I'm going to hand things back to Neil.
Okay, thank you, Debbie. I appreciate you sharing your experience and your stories with us today. I'd like to remind everybody on the call or logging into the webinar that you can at this time register a question for Debbie. The questions will be directed through me. They will be anonymous if you would like to register a question. I'll get the ball rolling with one question for Debbie. Debbie, maybe you could address a bit more about recognizing stress versus normal stress, workplace stress, versus recognizing something more serious that might require more attention.
I think I would resort back to sort of that, some of those lists of personality traits. For me, the biggest thing was a total change in your routine. You don't find pleasure in the same things that you did before. And for me, that was really, I think, the first telltale sign. I didn't find pleasure in hanging out with people or exercising or eating or going to movies anymore, watching television shows. It was just a total shift in who I really was. And it may be, mine, that's a kind of a total picture. It may be just one thing. Suddenly, you don't like talking to somebody at work because that person at work brings back the memory of some incident. So you really just have to, I guess, go to that touchy-feely place where you recognize what you're all about and sort of do a self-inventory. This is what I really am and what I like, what I don't like. Know what you're all about so that when things start to change, you recognize that's not the normal me. Something's going on. So really recognizing your own emotions and thoughts and feelings and recognizing when they change.
Okay, we do have a couple of questions coming in. Let me start with this one. A person that actually asked, I don't know the answer to this, but if you had a family or children while you were going through the trauma?
No, that was likely, I don't know if it's a pro or con. I was single. I had gone through my first divorce, so I was single at the time. I had met my now present husband, and we were dating, once in a while. But really, I don't have any children of my own. I have stepkids now. But at that time, no, I lived on my own. I had 2 cats that I talked to. But that likely, depending on your home relationship, if you were in a close relationship where you felt comfortable sharing with your partner what was happening, that likely could have been a huge bonus for me. But again, going back to that rescue personality, and even, after I did go through my counseling, I was dating my husband, my now husband, seriously by then, to the point where I asked him to come and meet my counselor, and he did, and, she kind of made him understand what I was going through. But I would seriously say to this day, I should say, I still, when I'm, feeling that I'm maybe going into a downer day or a dark spot, I still feel that little bit of embarrassment of telling him that I can't just, hop out of bed and get past it, that I'm feeling depressed. I won't always say to him. So having as open relationship as you can with family members, and, now they've started some what they call resiliency training for first responders and other occupations as well, where they include family members. So family members understand everything I've talked about, and maybe if you don't see something changing in yourself, your partner may say, you used to love doing this. What's going on? They may recognize it. So certainly being in a close relationship can be of huge benefit.
Okay. We've had a couple of questions about maybe the best way to communicate with your employer if you're facing a potential PTSD or mental health situation.
I don't know if I'm the expert in that regard because I did, I did just the opposite. I hid it. But more and more people are coming forward. And I guess it comes back to the old, at least in the police world, it was, you really didn't go to a supervisor and say, this is what's wrong with me, until you had gone to the specialist and had been diagnosed and so on. So having that, all the knowledge from your caregiver of what's happening to you and what's going on, and so that you have a clear understanding, so that when you do step up to tell your manager, you can comfortably explain what's happening with you, is a huge part. But I'd also, because mental health has finally sort of come out of the closet, there's so much online information, and there's so many different organizations and online help groups, chat groups, helplines. If you look on your local Canadian Mental Health Association, go to their website. They will have links to all different kinds of mental health agencies who you could call up and say, you know what, I've been diagnosed with PTSD. I want to tell my boss, but I don't know how to do it. Is there someone there who can give me some advice into that? And I know in the first responder world, there are plenty of peers out there who've been there, done that, and have walked that route and had positive and negative responses. But, if someone wanted to know more people who have done that for advice that way, Neil's going to mention it, but you could certainly email me and I could put you in contact with someone who's gone that route and stepped forward to their management and explained it, who could also maybe give you advice that way. So it's definitely a tough step, but it's the way it eventually should be. And I think more people in the human resources parts of businesses are starting to be trained to deal with people with occupational stress injuries appropriately.
Okay. Yeah, as Debbie mentioned, her email, I believe it's on the slide currently on the screen, but you can email Debbie directly if you have any questions about the presentation or you're looking for any follow-up. It's debbodkin@gmail.com. So there are a few more questions coming in. One person asked, in the workplace, they might cope with situations or deal with stressful days using dark humor or black humor. Do you feel that's appropriate way to deal with these kind of situations?
I don't know if I'd dub it appropriate, but it certainly is the reality, in many, many occupations. And I would never say it's inappropriate, because it is a way to get through it, and it's likely been around forever that, veterans, combat veterans do it, police do it, fire, lots of occupations do it. But it's not a coping mechanism. It's a way to, I guess, talk with other people about it and without breaking down. But it should definitely not be dubbed a coping mechanism. It is just, if you're there at the scene, and you're doing your job, you have to get through that part, or you want to. Black humor is a way you do it. I'm certainly guilty of utilizing that at many homicide scenes. It's just a way that people, as a human being, you talk to get yourself through it by trying to lighten the atmosphere or whatever, but it's certainly not a coping mechanism. It's just sort of a temporary, get your emotions together and get past it. But then you definitely have to go into learning how to cope with it appropriately. It's not going to fix anything at all.
Okay, so we're closing in on the hour, and I think I'll read one last question. How is a person, in order to reconnect with their own emotions, if they're in a stressful job in which they may have to divorce emotion from certain situations, what would you suggest is the best way to make sure you're actually in touch with your own emotions?
Do that mental health checkup, that annual mental health checkup. Even if you're at a good place in your life and, your emotions are, great, just like, even though I don't have any cavities, I'm going to have a dentist. I've gone to a dentist, I've had a checkup, and I know I don't have any cavities, and I now have a family dentist. Get yourself a counselor. Find somebody you like, because it's kind of like shopping for a friend, and you may not click with the first counselor you meet. So, go to a couple counselors and just say, you know what, I'm at a good place in my life right now, but I just wanted to find somebody I feel safe and comfortable with talking about, giving you a little background about me and about the job that I do. In the case that something changes in me, I want to be able to come back to you and talk to you comfortably and already know you. So it truly is the first step to looking after yourself is having that person in your phone book as this is my mental health doctor. I have my doctor, my dentist, my mental health doctor, you know, my whatever other healthcare professionals you may have on your list. Go and shop for one when you're in a good place. Don't wait for yourself to fall apart. Or, you know, talk to other people who've been through counseling and get a name that they recommend so that when you do start feeling things are going a little awry, I'm going to call this person who so-and-so told me is a really good person to talk to.
Perfect, thank you. Well, I think we'll have to end it now. Unfortunately, we won't get a chance to answer everybody's questions, but Deb, can you just repeat your email again?
Yes, please, and I'm totally happy. I may not get back to everybody immediately, but as quick as I could. It's all small case, and it's DEBB, so double B's in the middle, ODKIN @gmail.com. So debbodkin@gmail.com.
Perfect, thank you. Well, I'd like to thank Debbie very much for her time. I'd like to thank everybody for logging in and taking an hour out of your day, your busy days to speak with us. I'd also like to thank our sponsors, VFIS Canada and Homewood Health, for their generous support. And once again, thank you very much, everybody. And that concludes the webinar for today.